and these people live there for the most part. So you're like trying to manage things from, oh, my mom lost a sock, you know what I'm saying? But like in the hospital, it's like, girl, your mama lost a foot, like we gotta work on this, like forget the sock. Like, hey everyone, thanks for coming back to my channel. I am your fave nurse B. So today I want to talk about what my experience has been like in an LPN to RN program. If you all do not know, I'm currently an LPN, which basically is a licensed practical nurse. It's right underneath registered nurses in the whole nursing hierarchy. So I've already been to nursing school. I've already taken NCLEX and passed, state boards. I've already worked as a nurse. I still work as a nurse, and I've been a nurse for 6 years. So I know the whole, nursing game, and I know the whole nursing school game. And on top of that, I've done all of my prerequisites already to get into this RN program. So I just now currently got into my 3rd semester. So let me just kind of back it up. So I'm currently in an RN program, but before this, I was in the LPN to RN bridge. So basically, what a lot of schools do across the U.S. is that they allow LPNs to go into an RN program, and what they do is they pretty much take your LPN experience, the schooling that you had as an LPN, and they count that as your first semester of an RN program. So they say, you know what, you already done this, you already know this part of nursing, let's go ahead and count this towards your RN program so you don't have to take that first semester. So the school I'm in right now currently has 4 semesters, and then we take a summer break. So I came in on the 2nd semester, and it was just LPNs in one class, and they consider that class the LPN to RN bridge course. So it was mostly just us doing overviews, like small snippets of overviews of fundamentals, diabetes, hypertension, OB, and I want to say that's pretty much all we went over. So it basically was just like an overview of what they went over, I guess, in 1st semester. I don't freaking know if that's how they did it, but that's what we did. So then we had the whole summer off. I would say, like, my experience, I have a video talking about kind of how my 1st semester went, but I would say I just wasn't on top of studying like I was in my first time going to nursing school. So I kind of want to talk about like what my experience has been like thus far, and if I think it's harder to do LPN school or is it harder to do RN. Now, for me, people ask me that a lot. Is it harder for your LPN or is it harder for your RN? The thing is, you have to realize, like, I'm already a nurse. Like I said, I already went to nursing school, I already passed state boards. So everything that we going over right now in our RN program, I've already gone over all of this stuff. Okay, like, honestly, I've already gone over renal. I've already gone over musculoskeletal. I've already gone over skin conditions, STIs, female reproductive, like OB, Peds. I've done all of that in my LPN program, but now I'm basically doing it all over again in my RN program. So to me, it's not harder. To me, it's like a refresher course. Honestly, that's what it's been like. It's been a refresher course. I would say the hardest thing about it is just getting your mind back in the mode of, I'm studying. I got a test, every 2 weeks. Basically, we have a test every 2 weeks. Getting yourself back into the mode of, I gotta go to clinicals, I gotta do clinical paperwork, like, I gotta go again and freaking do these clinicals. I gotta basically pay to work for 12 hours or 8 hours at a place. Like, that's what it is for me. It's just getting back into the mode of being a student, being a nursing student, because I already did my prereqs, so that was my, being a student moment. But nursing school is different from prereqs, right? We know that. So I would say it's not harder. LPN to me was harder because I did not have any framework to work on except my experience as a CNA, which was a really good framework to work on because things that I saw in school or that we talked about in school, when I would go to work, I would kind of see it too, or I would know what to look out for. I would have a point of reference, and like my mind can be like, oh, that's what the nurse is doing, or oh, this is what's happening to the patient. I had that context there, And now I have that even more as an LPN going into an RN program. So it's not hard for me. Now, I'm not saying that I'm just going through and just sliding through, getting A's here, A's there. Hold on, y'all. Okay, y'all love how I came back with some random bracelets on. Anyways, so that's how my experience has been. I would say that it's also like, I'm noticing that my mindset is not going from, and I probably said this in an earlier video, my mindset is not going from LPN to RN. And maybe it is, I just don't see it, but really I feel like my mindset is going from long-term care nursing to hospital, more acute care nursing, because that's where I want to be. I want to be in an ER or in, I was thinking ICU, but when I talked to one of my instructors, she was like, do telemetry because you'll definitely have way more experience. You'll be able to multitask more. And she's like, the ICU is kind of boring. And I was like, I'm not here for the boring energy. Like, I need some upbeat, like, take me there type of energy. So probably either ER or telemetry. If I can't get into, you know, the ER, then I'll try for the telemetry. Or I'll do peds nursing, peds ER. I don't know, yeah, that's just down the line. We'll talk about that later. But anywho, just transitioning my mindset from just, now I'm learning more about actually what could be going wrong with that patient. Like really what is going wrong. But I would already kind of have that mindset when I would see a patient kind of going through certain things. I'd be like, oh, they probably need some IV fluids, or they probably dehydrated, or this and that third. But like now, it's like I go a little bit deeper and be like, they have a history of this, then more than likely this is the reason why the doctor is ordering this. Or like I'm actually paying attention more now to actual lab values. Like we learn lab values in LPN school. We just memorized it. I'm gonna be honest. We just memorized it. I did not. Once they told me that hospitals have a list of like, once you get your labs, you'll see, okay, this is the BUN. Say your patient's BUN is like a 12, and it'll say the normal, which is like 10 to 20, right? So they'll already have that. And once I realized that, or just 10 to 30, see, already, and it went out somewhere. It left my mind. But anyways, once I realized that, I was like, I'm not about to learn these lab values. So I'm learning the lab values, right? I'm learning what they are, but I'm also learning based on the lab value, what does that say about the patient? If their ammonia level is high and they have liver failure, or they look like they might have some liver issues, okay, more than likely they are going through liver failure, they're having some type of cirrhosis, whatever the case may be. So I'm able to make those connections between lab values and the actual patho of what's happening to that patient, and then okay, thinking about what I'm going to give. So it's just going deeper into like, okay, you give this medication for this, which is stuff we did learn it in nursing school the first time around, but everything was separate. So we had a pharmacology class, we had a pharmacology class, and of course we did A&P and what is that, developmental, like the development, you know, I know what I'm talking about, where it basically talks about like development through the lifespan. Oh my, growth and development. We took those prereqs as co-reqs within the program, but we would have individual classes with individual teachers, and everything was kind of like compartmentalized. So we had a pharmacology class where we learned about all these different meds before we even learned about the actual disease processes that connected to those meds. We learned about like IVs, like how to start an IV and things like that, before we really learned about, okay, why would I be giving an IV, this and then the third. Like we learned about those things separately, but now, and then once we got into med surg, that's when everything came together. But now it's like we're learning everything at the same time. So teachers are emphasizing nursing management, they're emphasizing pathophysiology, they're emphasizing pharmacology, all at the same time as they teach about different disease processes and things like that and what we're supposed to do, right? So everything is all connected, versus when I was at LPN school, they separated it and then try to make it come all together at the end, which I guess for some people it was good because you saw the information twice. So you would see it in pharmacology, you would learn about pharmacokinetics and all that good jazz, and then you would go into your med surg and actually see, oh, this is why we're giving this. So you saw the information twice. But sometimes that first time around, especially in pharm, that first time around, it could be hard to understand pharmacology because it's like, I don't even understand the disease process and you're telling me to give a medication. So it's like, if you don't really know why you're giving it or what's happening to that patient in their body, like, you know, physically happening, it's kind of hard to connect giving a medication to correct though, you know, or to actually treat those signs and symptoms, I should say, because a lot of times they don't be correcting that. They just treating signs and symptoms, honey. They're just trying to keep you alive with that pill. They ain't really getting to the root of the issue. But honey, that's another video. I digress. Now, if I were, so I think honestly, if you have no experience in nursing and you go into either an LPN or an RN program, they're both, in my opinion, they're both probably going to be equally hard because you don't have any experience. You ain't got no experience doing this stuff, so everything is new to you. Now, granted, you know, in that RN program, they do go deeper. They do go deeper. I'm not gonna lie. But honestly, like, the more I'm thinking about it, I'm like, I feel like I learned all this stuff already. Like, I learned all this stuff already. I'm just like relearning it. And I think I'm allowing myself to go deeper too, because I'm like, okay, this is honestly my last chance I'm gonna get to really know this information. Versus when I'm in, you know, unless I, of course, you know, they say nurses are lifelong learners and you got to constantly keep, you know, learning and growing on your, what you know. But to get these basics of nursing, like the basic understanding of what kidney disease is and the medications that you're giving and the treatment, what that patient looks like and how things are going to look for them. That's something that you learn in nursing school. Like, you're going to, I guess, at your job they might go into it, but you come into the door should already know this, right? So like I'm saying, this is my last time around for me to really get this basic information down, because this is just basics. Like, I remember a teacher said, like, we're only giving you all 10% of what you need to know. That's all we have to give you all. That's all NCLEX expects us to give you, is 10% of what you need to know in order to make sure these patients don't die. And that's really what it comes down to. They want to make sure that you're able to practice nursing safely, to practice as a nurse in a safe way. That's really what they want for you to do. That's all they're expecting you to do, is just make sure you keep them okay. Keep them safe until somebody else come around that's more qualified, okay? That's really what it comes down to. Hold on. Because we're not diagnosing and we're not prescribing. So we're holding them together until we get some orders, right? But of course, nurses do more. I'm not trying to downplay what a nurse does, but that's what we're expected to do at the basic level. Like, really, that's all we need you to do. Man, this tea is hidden. Something fierce for my body. But that's how it's been so far. I'm trying to think, is there anything like I can go more into depth about? I definitely want to say, like, that first semester, the bridge semester, I felt like I slacked a lot. Like, I wasn't studying as much as I should have. It took me a minute to get into the groove of actually studying, because everything was from home. I don't know how the hell y'all did it. People who went through nursing school, like, basically all through COVID, like, y'all some beasts, because I don't know, like, I was able to do it. Like, my husband was super supportive with the girls and everything like that. And like, I was disciplined enough to be on top of like coming in, being there for the whole lecture's time and focusing on the lecture and doing all that, getting everything I needed and listening to lecture over and over again. But it's just like, yeah, being in class is so much better, so much easier than doing online school. I think people think the other way around, but for me, I'd rather just be there to show up, because I take time before class to study, and I don't take time afterwards, just because I take time beforehand. So it just gets me in a better rotation as far as like my routine for me to actually go to a school physically. So right now we are on campus. Now I know a lot of people were like, oh, did you get the jab? So my school, I already talked about this in a separate video, but My school does not require it, but the clinical sites we do does require it. So I did go ahead and get it. And I have other reasons why I got it too. But that's not even something that needs to be talked about. Hold on. I will say that I definitely feel more equipped as a nurse than I did as an LPN. Like, I don't know. I think it's honestly because I'm coming into it knowing exactly what I want to get out of it, knowing exactly what's on the other side of nursing school. I feel like that puts me at a really great advantage, is that I know a lot of things that we say we're going to do does not play out, in the actual clinical setting. So I honestly think sometimes it kind of hinders me because I'm like, what does this really look like? You're saying if a patient has this is what they're going to do. The doctor's going to order this, da 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 da. But it's just like, I don't know. Like, I'm just trying to wrap my head around going from long-term care nursing to emergency care nursing. So that's where I'm trying to wrap my head around that transition. And like right now, my main focus right now is keeping up with labs and keeping up with medications, because those are really, really big things in general, especially in conversation. Like, I used to think, oh, well, they just had the labs on the paper, so I don't have to remember it. But when you're in conversation with people, once I actually realized, like, you're going to be talking to doctors and you're going to be talking to other nurses and you're going to be throwing out, oh my gosh, when she came in, her BUN was like 54. And, I would be like, oh. But I'd be like, I don't know what the hell that normal BUN, and if it's elevated, I don't know what the hell that means. But now if I hear, okay, her BUN is 54, oh, okay, did they start her on fluids? What happened? Like, how's her kidneys looking? Like, what's her creatinine levels? Like, things like that. Oh, now I know why. Or when I would talk to a doctor and be like, hey, your patient, we got back the UA, which is a urine analysis on them, and she does have an infection. It's over 100,000 whatever amounts of bacteria. This is what it's sensitive for. Like, I didn't learn that in nursing school. Like, as far as like reading a UA and learning like sensitivity and which one you should recommend to the doctor and all that, I didn't learn it until I started working, right? So, but what doctors will always say, they'd be like, what is her creatinine? What is their creatinine? And I would be like, why does it matter? But now I know it's because they want to see, okay, if I give them this, is this going to really mess up their kidneys? Like, is it better for me to give them this or give them that? I want to fix the infection, but if I'm about to, mess up this old lady kidneys, like, it's going to be a problem. So let me see what I need to do. Those type of things. Like, now I'm actually, instead of just carrying out the order, instead of just, taking what they tell me to do and just doing it, now I'm really starting to think, okay, why are they asking for this? Why do I need to do this? Why do I need to get orthostatic blood pressures on patients? Why do I have to, like, the why is constantly coming back up. And I would see this, and then like sometimes I'm not going to be lying, like sometimes when you're working in long-term care, I'm not saying that you start to slack on your abilities as a nurse, because long-term care can be very fast-paced because you're juggling a lot of patients. You could have anywhere from 12 patients, which is like amazing. You could have, like, I had 19 patients on a skilled floor, meaning it was a rehab floor, and I had 2 CNAs and no CMT. So I'm passing meds, doing everything for these patients for 19 people. Now somebody be like, that's not that many, da, 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 da. But this is like a skilled floor. Like, these people just came from the hospital. Like, they don't live there. They just came from the hospital. They're more acute care, right? But then I could go on another floor and have 50-some patients with a CMC and 3 aides or 4 aides. And it might be a little bit easier than night, or I might be running around the whole night. So a lot of the times with long-term care nursing, you're managing your time like to a T. It's really about time management. You become more task oriented when you work long-term care, because you have hella patients, y'all. Like, you got a lot of patients, and these people live there for the most part. So you're like trying to manage things from, oh, my mom lost a sock, you know what I'm saying? But like in the hospital, it's like, girl, your mama lost a foot, like, we gotta work on this, like, forget the sock. Like, that's what you're coming down to when you're in the hospital. It's more like, let me focus on what needs to be done and, you know, keep it pushing, you know. And it's more like patient teaching. It's more about, you know, letting them know about why they're on these medications, because more than likely they're going to start those new medications in the hospital. They're going to stop certain medications in the hospital versus in the long-term care. These people have already been living with these diseases, with these conditions, disorders for a while. So you're really there to maintain them or to notice any changes and be like, something ain't right, let me call the doctor. Versus in the hospital, you know, the more acute setting, you know something isn't right. You have to figure out what the hell it is that's going on with this patient. And like I said, you're teaching them. You're like the first person that's going to be initiating their understanding of their disease process, because they might not even know that they have a certain disease or disorder, or they have to do certain diagnostic testing and things like that until they get into the hospital. Now, this is me being more theoretical because I don't work in a hospital. So in my mind, I'm thinking this is what I have to switch my mindset to, is thinking like this. So I'm actually going to, but I won't know until I do it right, but I'm starting to slowly but surely switch my mind to more so the educational role, which they always say like the RN is more the educator. But all nurses are educators. But honestly, like the RN is more the educator. They're more the ones that initiate things, things like that. So, but I didn't always think that, because any RN that I worked with was working right next to me doing the same ish as me. And they'd be asking me questions as the LPN. So, because we were in that setting. But as I switched to a different setting, I switched to a different mindset. Like I said, it's not just LPN and RN, it's long-term care nursing to hospital nursing. So that's how I see it. I know other people might be like, well, no, it is. But that's how I see it. Hold on. That's just where my mind is at. But I do plan on sitting down with all of my teachers. I got to take my grades. Should I take out my grades in this video? Or like, is this video too long? I don't know. But maybe I'll do a separate video talking about that. But I do want to sit down. I have actually a meeting with one of my teachers Friday. And what I'm going to do is ask them like any tips that they have on being able to, like, where should my mind be at right now? How should I be changing my thinking? Because if you have no basis, then you're just taking whatever they tell you to take in. I have a basis to work with. So I need to basically change the way I think, or transition myself to think a certain way, because I already have a basis. So I don't want to just rely on my basis as an LPN and be like, this is what I need to, like, this is like, that's not how it really goes down and you know, in the real nursing game. Like, that ain't how it going in the nurse game for real. So I ain't gonna listen to what these teachers say. Let me just go ahead and answer this question, get it right, but I ain't about to do that. Like, no, I don't want to have that mindset. I want to change and shift my mindset, because I am in RN school, so I want to get what I need to get out of it. So I am going to ask each one of my, because I have 3 professors for one class, which is crazy. But I want to ask them, like, individually, how do you think I should go about changing my mindset? Should I change my mindset? How should I start looking at things differently? And I'm going to be like, look, everything that y'all telling us, we've already went over. I've already gone over this in LPN school. And I don't want to just rest on that understanding. I want to see how I should shift it. Does that make sense? I'm not keep saying the same thing over again. But I do plan on asking all my teachers, like, just getting some, like, picking their brain and really seeing how I can be a better nurse. Like, that's my goal. Like, yes, I know I'm going to be an RN. I know I'm going to do what I got to do to get there, but I want to be a better nurse. I want to be a stronger nurse. I want to be, like, I just want to be a better nurse. Flat out. Like, I love you all. I'm going to go be with my family. Peace. I'm going to go not study. I'm not studying today. Like, okay, I'm going to study a little bit because I got clinicals tomorrow. But anyways, I love y'all.